Please see full important safety information on side of video and stay tuned for the full ISI at the end of this video. In the non-Parkinson's brain, movement is regulated in the basal ganglia via the direct and indirect pathways, also called the go and no-go pathways. Dopamine and adenosine play a key role in regulating movement. Dopamine and adenosine are like the gas and brake pedals in a car, respectively. Stimulation of D1 on the direct go pathway and D2 on the indirect no-go pathway receptors is like pushing down on the gas pedal, which promotes movement, while the stimulation of adenosine A2A receptors is like applying the brake, which suppresses movement. Adenosine and dopamine, D2, play critical roles in regulating indirect no-go pathway activity. Adenosine activation of the A2A receptor excites the indirect no-go pathway, which suppresses movement, while activation of the D2 receptor by dopamine inhibits the indirect no-go pathway and promotes movement. Coordination between adenosine A2A and D2 receptor activities is believed to result in normalization and balance of overall indirect no-go pathway activity. In contrast to the non-Parkinson's brain, in Parkinson's disease, dopamine levels are reduced, and studies have shown that adenosine A2A receptor expression is increased. Stimulation of the increased number of adenosine A2A receptors, together with reduced D2 receptor function resulting from dopamine loss, causes overactivation of the indirect no-go pathway, while decreased dopamine levels reduce activity of the direct go pathway, leading to an overall decrease in movement. NOURIANZ, a non-dopaminergic adenosine A2A receptor antagonist, works differently from other treatments to address off time in Parkinson's disease. Although the precise mechanism of action for NOURIANZ is not known, it may reduce overactivation of the indirect no-go pathway by blocking the adenosine A2A receptor, like releasing the brake pedal of a car. When combined with levodopa-carbidopa, which is converted to dopamine and affects both the indirect no-go and direct go pathways, NOURIANZ may help address off time in Parkinson's disease. NOURIANZ seems to work differently from other approved treatments to address off time in Parkinson's disease. It is an adenosine A2A receptor antagonist approved for use with levodopa-carbidopa in adults with Parkinson's disease experiencing off episodes. Indication: NOURIANZ, istradefylline, is an adenosine receptor antagonist indicated as adjunctive treatment to levodopa-carbidopa in adult patients with Parkinson's disease, PD, experiencing off episodes. Important safety information. Warnings and precautions. Dyskinesia. NOURIANZ in combination with levodopa may cause dyskinesia or exacerbate pre-existing dyskinesia. In clinical trials, 1% of patients treated with either NOURIANZ 20 mg or 40 mg discontinued treatment because of dyskinesia, compared to 0% for placebo. Hallucinations, psychotic behavior. Because of the potential risk of exacerbating psychosis, patients with a major psychotic disorder should not be treated with NOURIANZ. Consider dosage reduction or discontinuation if a patient develops hallucinations or psychotic behaviors while taking NOURIANZ. Impulse control, compulsive behaviors. Patients treated with NOURIANZ and one or more medications for the treatment of Parkinson's disease, including levodopa, may experience intense urges to gamble, increased sexual urges, intense urges to spend money, binge or compulsive eating, and/or other intense urges, and the inability to control these urges. In clinical trials, one patient treated with NOURIANZ 40 mg was reported to have impulse control disorder, compared to no patient on NOURIANZ 20 mg or placebo. Drug interactions. The maximum recommended dosage in patients taking strong CYP3A4 inhibitors is 20 mg once daily. Avoid use of NOURIANZ with strong CYP3A4 inducers. Specific populations. Pregnancy, based on animal data, may cause fetal harm. Hepatic impairment. The maximum recommended dosage of NOURIANZ in patients with moderate hepatic impairment is 20 mg once daily. Avoid use in patients with severe hepatic impairment. Adverse reactions. The most common adverse reactions with an incidence of greater than or equal to 5% and occurring more frequently than with placebo were dyskinesia 15%, 17%, and 8%, dizziness 3%, 6%, and 4%, constipation 5%, 6%, and 3%, nausea 4%, 6%, and 5%, hallucination 2%, 6%, and 3%, and insomnia 1%, 6%, and 4% for NOURIANZ 20 mg, 40 mg, and placebo, respectively. You are encouraged to report suspected adverse reactions to Kyowa Kirin Incorporated at 1-844-768-3544 or FDA at 1-800-FDA-1088 or www.fda.gov/medwatch